Hi, my name is Dave Stewart. I'm a manager of mental health services at Sara Riel Inc. We provide community-based services to individuals struggling with mental illness, mental health concerns, substance use, and addiction issues. And our services include mental health counseling and case management, employment services, life skills development, peer-supported mental health respite, and a peer warm line that offers telephone services to anyone struggling with mental health concerns, providing compassion and caring. Typically, community-based service means that we meet people where they're at. We meet in their homes, we go to their communities, as opposed to needing to travel to our location to get services. But COVID-19 put a big dent in that. Many of us were not prepared for the issues that long mandated isolation would create. Access to services and resources were significantly limited. We were unable to visit family and friends the way we were accustomed to. And many of the stresses and strains that came from it, for individuals and families, these were things that were totally new to us. So finding ways of staying connected became a very important task. In the beginning, we had no way of knowing how long this isolation was going to last. Even we had to adjust our means of communication to some of our folks, limiting it to telephone calls or virtual video chat. So now, with restrictions being relaxed and then reintroduced and enforced, and cases decreasing and then increasing, many of us are still intent on having a healthy respect for the recommendations and staying safe at home. The need for strategies to ensure good communication has been a constant struggle since the onset. And hopefully, I'm going to try and provide you with 3 communication enhancing tools that I hope will offer some benefit. First, we have to understand 3 general factors. One is that we are not the only ones dealing with issues as a result of COVID-19. Everyone is affected in some way. Even those people who don't appear to be affected, they're likely surrounded by people who are struggling. And we know that that carries over. Brings us to our second understanding is that we only know and see what people allow us to know and see. A lot of people are very private. Sharing thoughts and feelings and emotions leaves a lot of people feeling vulnerable. So we don't and won't know everything that they're going through. And the last is some research on communication itself. It states that we can achieve 100% of communication through face-to-face encounters. Hearing the words, the vocal tone at which they are presented, and noticing the body language gives us the opportunity to achieve maximum communication. If we can't see the person, we take away 55% of that body language. A telephone call, we can hear the words and we can hear the tone at which they're presented. And that gives us an opportunity to pick up only 45% of communication. That's a little less than half. The lowest form of successfully achieved communication is one that's very prevalent, 7%. And that would include things like social media and email. Just think of how many arguments or hurt feelings have come from a miscommunication or a misunderstanding based on what someone's written on a Facebook post or in an email. And so understanding those factors, I'm going to share these 3 tools, which I hope can be helpful. The first one I'd like us to look at is called the ring theory. More informally, it's called comfort in, dump out. And just so you know where it comes from, I'll give you a little bit of history. A clinical psychologist who played a part in developing this theory was battling breast cancer. And what she found was even her most well-intentioned and closest friends and people around her would often come to the hospital and share their experience in the hospital. Oh, I was in for this or something. They would share their physical maladies, their illnesses. They would vent their frustrations even on the inconveniences that her illness was causing them. Inadvertently, of course, they would say, "You know what? I had to park way over here, or I had to pay for parking." This was a way of reducing their own anxiety. But ultimately, what she found was that people were dumping on her while she was trying to struggle to recover. So to explain it, she came up with these series of rings. Where you place individuals based on their closeness, and the guidelines is that you only provide comfort to those in the same or smaller rings. And if you need to vent, you choose someone in a larger ring. So you see, if you vent out to someone in a larger ring, it would make sense that their job is to comfort into the smaller ring, and that's where you are. Um, Not everyone knows this or follows it, but if you take some time and define your own circles of support, you at least have an idea of where you can go to get stuff off your chest without adding stress to the people you need to be supporting. The other factor you have to think is that it changes. So whoever is in the person needing support, you may have a coworker who is in outside your circle that you use for support. But if they present with an issue that they're struggling with, they become the inner person in that circle, and you need to provide support in. Now, very likely their need for support is going to affect you, and so you may need support. So you'll have to create a new map to identify people that you can use to gain support and vent to. So with this information, you can begin to map out who you can count on to listen to you vent or to provide you some support when you need it, while you ensure that you're providing support where it's needed. Doesn't mean we can't talk to those people in our same circle. If you're isolated with a partner and children, you need to be able to talk to that partner and tell them what's going on for you. It just means we have to do it more effectively. And so that brings us to tip number 2, which is before you vent, reveal your intent. And this works whether you're the speaker or the listener. It's very helpful in your communication with friends or family to clarify your position or role in an important conversation. When someone shares a problem with us, we often don't know if they want us to help with a possible solution or if they're just getting something off their chest. Um, I don't know if this has happened to you or not, but you may be engaging in a little negative venting about your partner, and the person you're telling adds something negative about your partner. And it's like, I can do that, but you can't do that. That's my partner you're talking about. Or you may be venting about work and they come in with, oh, they treat you like garbage. I would quit if I were you. And in your head, you're thinking, but I love my job. I'm just trying to express some frustration. Or one of the worst is when you finish your problem that you've been mulling over for a while and you're inundated with, you should do this, or I would have done that. Um, all you really wanted was someone to listen to you, to hear you. So clarifying that from the start is a good way to avoid unhelpful situations. Saying something like, I need to vent. If you're okay with it, I'm not really looking for answers. I just want to get this off my shoulders. Or, you know what? I need to say this out loud to someone who I can trust not to react or agree or disagree. Is that okay with you? It also works when you're on the other side of the conversation. If someone shares with you and they don't make it clear, just ask, did you want me to listen, or do you think it might be helpful for me to come up with some solutions with you? It's actually a really caring and empathetic way to respond to someone. It lets them know you're willing to be there for exactly what they need at the time. And if they say, listen, just listen. You can respond. Keep it focused on them. I can see why you felt the need to get this off your shoulders. Or I can tell this is really frustrating for you. But keep it focused on them and their feelings. Don't ask for more information. Don't challenge their perceptions. Just base your response on what they've chosen to share. And just because they ask you to listen, it doesn't mean they won't change their mind after and ask for your advice or help. And that brings us to communication tip 3, which is ask, provide, ask. This comes from a model called motivational interviewing. And if you are asked to help, it's a trick that a lot of counselors use. So it looks like we're not pushing ideas onto you. It's called ask, provide, ask. So that's what it is. Someone shares a problem with you and says, what do you think I should do? You ask, are you okay if I share a resource with you? Can I share something that worked for me? You know what? I haven't dealt with anything like that, but do you want to hear what my idea would be, what I would do? This way, you're giving someone choice, and choice is one of the greatest gifts you can give to someone who's feeling stuck and trapped in their situation. If they respond yes, that they would like to hear it, then provide your ideas. I'll warn you not to use words like "you should do this" or I would make it, when this happened for me, I did this, or I might do this, or I heard that a friend tried this. Um, and then after you've provided, ask again. Do you think that information will be helpful? So ask, provide, ask. It's helpful, it's considerate, it's respectful. In times like this, living situations that have never existed for us before, communication is key to keeping our relationships healthy. I hope that these communication tips will inspire you to try making some changes to enhance your communication with the people that you're closest to. Thanks for listening. Take care.